All right, we've been hearing a lot about, let's move on to another popular topic, vitamin D.
Vitamin D,
We've been
definitely.
hearing a lot about it. What are some of the benefits of vitamin D?
Well, you know, we've always known that vitamin D plays a role in bone mineralization. That's pretty well established, but research is showing that it has to do with cell division, and it has to do with muscle strength and our immune system. So we've always known that vitamin D is considered to be the sunshine vitamin. In other words, we don't have vitamin D in our bodies until it is converted by the sun. So light-skinned people need about 15 minutes of sun exposure, mostly on your arms and legs as opposed to your face. So you want to protect your face, but if you're out pruning the flowers or something, get a little sun exposure is a good thing. Of course, in Minnesota, where we have a lot of clouds and we have a lot of poor sun exposure for most of the year, our vitamin D stores don't carry us through, and we're not getting the kind of sun exposure. So in this area, about 40 to 50% of the population, regardless of your skin color, is low on vitamin D. So it's up to you to ask your doctor to run what's called the D25 Hydroxy Test. So it's basically say to your physician, if you feel like you're at risk for low vitamin D, and some of the symptoms might be the winter blues that never go away, sort of that blah feeling, and also bone pain possibly, and just general fatigue.
Oh, wow.
So if you feel like you're at risk because you don't get that sun exposure and maybe you don't drink a lot of dairy products that are fortified, you might ask your physician to have your vitamin D level checked. So the magic number is 30. If you look at the illustration where it says D-hydroxy, 25 hydroxy rather, the magic number is 30. You want that number, that blood test number, to be 30 or better to show that you have sufficient stores. Does that mean that you shouldn't supplement with D or get your vitamin D if your levels are normal? You want to maintain those good levels by getting your daily allowance of vitamin D.
Now you mentioned the dairy products that are fortified with vitamin D. Can you also get it from other food products, and how do you have to eat a lot of these different
You
foods?
would have to eat quite a bit. Fish has some vitamin D in their tissues. A lot of people are taking fish oil these days for the omega-3s, and you would think that there would be vitamin D in fish oils. In fact, I was kind of surprised there wasn't listed.
Like vitamin E? Or?
Yeah, vitamin E occurs naturally in fish oil. The one exception is cod liver oil, because vitamin D is stored in the animal's liver primarily. So when we consume like chicken liver or beef liver, we're getting a big dose of vitamin D. And anybody who had to take cod liver oil when they were young, we're getting a big dose of vitamin D. So it's found somewhat in fish, but less than 100 international units in a serving of fish. So that's not that significant. And over the years, they've fortified milk products. And if you look at the one that has the milk label on it, at the very bottom of the nutrition facts, it lists out calcium as a percentage and also vitamin D as a percentage. Now, you're not going to see vitamin D on very many labels because it's not found in very many products unless it's fortified intentionally. So you notice that in this particular nutrition fact label, this happens to be a cup of milk, and it can be skim or vitamin D milk, which some people think that the whole milk is fortified, whereas the skim or low fat is not. They're all equally fortified. So a glass of milk provides 30% of the US RDI for calcium, which is 1,000 milligrams currently. So when you take 30% of that, if you look on the right where it's light blue, 30% means a glass of milk provides in calcium 300 milligrams. And so a cup of milk contains 300 milligrams. Also on the vitamin D, since the current US RDI is 400 international units, 25% of that is in a glass of milk. So for every glass of milk, you're getting 300 of calcium and 100 of vitamin D. So if you look at the other illustration I have, if you are a consumer of milk products, let's say you have 2 glasses of milk, a serving of yogurt, and as an example, I used just a plain 6-ounce Yoplait and checked the label, and you can see there's 300 in each glass of milk plus 100 of D, and then the yogurt gives you a bit less, 200, and then less than 100 of D. So if we just take the first 3 things, we've got almost 800 of calcium So we're getting there. Even if you have another serving of cheese, you can make your calcium needs through your diet. However, the vitamin D is less than 300, and there's not much in the cheese. So you have to have vitamin D either through the sun exposure or through fortified products or through supplementation.
And even if you're, let's say you're drinking the milk and having the yogurt, do you still need to get that sunshine to help process that vitamin D in your body?
Well, there's dietary sources of vitamin D that are absorbed directly from the food through your intestines. So no, that is assimilating that way. The conversion from the sun provides lots of vitamin D, and it can be assimilated all at once. So it's getting big stores of vitamin D through the sun exposure, much more than in a serving of a dairy product.
So if you're not doing the dairy products, you need to take a supplement? Or can you
If
get it
you're
from
really
leafy?
at risk for not getting enough sun exposure, if you're protecting your skin or you live in the northern latitude where you're not getting the sun exposure, it doesn't help that you get a lot during the summer because the 9 months of winter are depleting those stores. So you really want to maintain it through supplementation. If you look at the one where it talks about how it's going to increase, the RDI, or the recommended daily value as it's sometimes called, is currently 400 for the average population, which is children over the age of 1 all the way up to age 50 adults, is 400. They're going to at least double it. It's probably going to be increased to 1,000, which is going to be equal to calcium. So if you're using percentages on vitamin D, instead of 100%, you need at least 200% of what it says on a label currently.
And this is hot off the presses that they want to increase the recommended doses of
right,
vitamin
and it just
D.
hasn't, because RDIs are established as a grouping and they are published all at once for various nutrients. That's why we haven't seen it officially change, but it's very certain it's going to at least double and probably double 2.5 times the current US RDI for the different age groups.
Any other advice that people should know about vitamin D?
I think that you should be your own advocate. If you feel that you're at risk for low vitamin D level in your body, encourage your physician to run that level and find out what it is and then get treated. Typically, if your levels are lower than 30, your physician will prescribe a large dose of vitamin D, which your body will store and bring your blood levels up to normal. And then once 3 months have passed, 8 to 12 weeks, then you need to be sure that you're getting it in the form of a supplement or through your diet from there out to keep your levels normal.